Okay. Mr. Chairman, thank you for the opportunity to be with the committee this afternoon. I'm the Reverend Alexander Sharp. I'm from Chicago. I'm executive director of a national group called Clergy for a New Drug Policy. Our mission is to mobilize clergy nationally to end the failed war on drugs. You've heard quite eloquently the fact that the war on drugs has failed. And rather than the paradigm we have now, it's to seek a health, not punishment response to drug policy. Now, I realize I'm not from Maryland, and I appreciate the opportunity to speak, and I think my time in front of you is merited because I can bring forward to you some examples that are working, that are vivid ways of illustrating the paradigm that Delegate Morhaim is describing. We know, I'm sure all of you know, the arguments for this legislation insofar as you support it. First of all, it contributes to public safety because it can allow a reallocation of law enforcement to higher priority areas. It reduces prison time, or will reduce prison time, and it keeps from being mangled lives that are just going to be crippled if people are brought into the criminal justice system. And the word diversion is used because we're about diverting, and now the term is even deflecting people from the criminal justice system who shouldn't be in it. I've only got 3 minutes, so let me refer quickly to the 3 examples where I do have firsthand experience. 6 years ago, I went to Seattle, and I visited the first pilot program of what's called LEAD, Law Enforcement Assisted Diversion. The stakeholders there, from the city police chief to the mayor to the county executive to the public defender's office, all gathered together and said, what we're doing doesn't make any sense. And they created an agreement amongst themselves so they could protect each other's back with a social service agency. Police now are able to direct people that they've seen, recidivists, low-level drug offenders, prostitutes, to services. The recidivism rate has been reduced by 60%, and costs to law enforcement are down. The second example is one that you may scoff at, but I urge you not to. It's the country of Portugal. Before I cite what happens there, let me say that Portugal is bigger than Maryland, and the chief city, Lisbon, is far bigger than Baltimore. And what they've done there, we have an example we can look to, and we should. They have decriminalized all drugs. I was in Portugal 2 years ago. I visited the treatment centers. They refer people to treatment unless they're obviously traffickers because of the amount of drugs that they have. Drug use has not increased. It has gone down, especially for youth. Crime has not increased. More people are in treatment. Law enforcement costs are reduced. It's a real live example. May take some imagination to apply it here, but the principles are absolutely the same. And here's the third thing that will knock your socks off. Because of our opioid crisis in this country, police chiefs, and I saw one of the first in the country in Mundelein, a conservative North Shore suburb of Chicago, have decided to offer the opportunity for treatment rather than arrest if people come in and turn over their paraphernalia. The police chiefs, and it's called an ANGEL program, where it first started in Gloucester, Massachusetts, will take them directly to treatment. This is diversion, and in some way, all 3 of these examples parallel what you're talking about when you say we shouldn't arrest, which is a form of violence, people who have not harmed others, and if they're addicts, deserve treatment. If they're recreational users, certainly aren't going to be having their lives improved by being in jail. So I thank you for your time. I'll be delighted to answer questions.